Hi, my name's JoAnn Uding. I'm one of the nurse practitioners at St. John County Memorial Hospital. I would like to welcome you to the virtual Women's Health Fair. I have the new privilege of championing the Bone Health Clinic, and I'd like to share some information with all of you regarding bone health. Osteoporosis is a condition that evolves as we age. Women over 50 have a 50% chance of having a fracture. 1 in 2 women will fracture a bone after the age of 50. 1 in 4 men will fracture after the age of 50. The good news on that is the men actually catch up with us by the time they're 70. In America right now, 300,000 individuals have had a hip fracture in the past 1 year. That's just a huge number. When you think about that, 150,000 of those individuals will go on with treatment to be home and recover. 75,000 individuals will actually pass, and 75,000 individuals will need nursing home or chronic care. So this is why it's just imperative that we treat our bones. A fracture is an urgent matter. It means osteoporosis treatment needs to be looked at. People who are at risk are individuals who have a low bone density, individuals who may have had a previous fracture after age 50, individuals who have vitamin D deficiency, or some other chronic illnesses such as diabetes, which Regina's going to talk with us about. Diabetes puts us at a higher risk of osteoporosis, celiac disorder, all sorts of things. So it's really good to do a consultation, kind of go over what the risk factors you may have are, what your bone density T-score would reveal. Beyond that, we do something called a FRAC score. The FRAC score will help us determine an individual's 10-year risk of a fracture. We also do a lot of consultation in terms of how much calcium are you actually getting in your diet per day, how much vitamin D, and what sort of supplementation we would use beyond that to meet your nutritional requirements. Bone densities can improve with exercise, so there's always ways that we can improve our health and our lifestyle. At the visit, we also have a physical therapist who actually spends about 30 minutes with each patient, and we do a balance assessment and a strength assessment and look at all of those factors. As far as medication goes, there's a plethora of products, and some actually are anabolic and build bone, some are anti-reabsorptive and slow down the loss of bone, some are oral, some are IV, so some are actually injectable meds that an individual would have to use on a daily basis. So it would be a good thing to know your own bone density, to assess your calcium and vitamin D requirements, to look at your lifestyle and what can be modified. Tobacco works against our bone density. Alcohol use, more than 2 drinks per day in a woman, or 3 drinks per day in a man, would work against our bone density. Things that would increase our fall risk, and certain medications that we take for other reasons can also work against our bone density, such as SSRIs for depression, or the PPI drugs that we take for acid reflux and heartburn. So if you'd like an assessment, I would love to see you. And I am at the Point-Based Medical Center. You can see me with a referral from your doc, your primary care person, your GYN, and or just call 573-883-2782, and we'd be happy to get you on our schedule and take a look at things. Thank you so much.